In today's episode, we're talking to Dr. Jennifer Giordano. Widely recognized as Dr. G, Dr. Giordano is a psychiatrist who uses a holistic approach to help those who want to take an active role in their own health and avoid, decrease, or stop using psychiatric medications. She saw the major gap in the medical community in the understanding of psych med tapering and wanted to help fill it, which grew into working one-on-one with hundreds of people navigating the tapering terrain. Amidst the rampant use of psychiatric medications, Dr. G believes that people deserve to know their options before considering mind-altering medications. She guides patients to safely come off psych medications through an expert holistic mental health care and a common sense approach. If you'd like to learn more about how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry. We're an online practice who takes a whole body approach to mental health, and we treat adults with anxiety, depression, and sleep issues. And we also provide nutrition services for mental health. Okay, Dr. Giordano, I'm really excited to connect with you today, to have this conversation. We've known each other for many years. We actually did our residency in the same program many moons ago. So it's just so lovely to see your journey unfold and to hear about your practice. And today we're going to be talking about tapering psychiatric medications, which is a question I get asked about a lot.
Wonderful. I'm so delighted to be talking to you today. It's fantastic to be a part of your podcast here.
Yeah, thanks so much for doing this. And I know you've just started your practice recently, which is focused on tapering psychiatric medications. Maybe we can start by talking a little bit about why you decided to take that approach or to focus your practice around this. And then we can get into some questions about the logistics of tapering, because I know that people who are listening to this are probably interested in hearing more about that. But maybe you can tell us about your practice and why you decided to make this your focus.
Yeah, happy to do that. I've always been interested in a holistic approach to mental health which kind of started with my own struggles with anxiety earlier in my life in college and things like that, and trying to find solutions to that. And I tried the gamut. I tried medications. I tried all kinds of things. And ultimately, for me, it was a holistic approach or a myriad of things that would be considered holistic. That was the solution that I found for my own anxiety. So that's just my nature. I mean, that's just how I was built. And having gone through the traditional psychiatric medical education route, I know that route as well. And having learned all of that, all the medications and all that kind of stuff. And then fast forward to 3 years ago, I was involved in working for a practice where it was a genuinely holistic approach. You create a whole wellness plan that had all kinds of recommendations, including things looking at the person's medical health or looking at their physiologic health through lab work or through their medical history. And then also talking about diet, nutrition, exercise, stress reduction, therapy, their relationships, their past traumas, how do they like their job, looking at all of that to help people be as healthy as possible, as naturally as possible. And then started to learn about, I knew nothing about this whole idea of having to taper psychiatric medications slowly. I had some clue about like benzodiazepines, because that's widely recognized in the psychiatric community as a medication that a person can become physiologically dependent on. But what started to become clear is that people were just naturally reporting their struggles with coming off the other classes of medications, including the SSRIs or the antidepressants, or even mood stabilizers and antipsychotics in some instances, especially if they're being used for sleep or mood stabilization. So I honestly started listening to people. Really, that was the big change for me, was rather than being so stuck in, but this is what I was taught, because that would come up repeatedly. But it shouldn't be a problem to come off Prozac, really. It just cut it in half and then in half again and then stop. But people were pretty adamant that wasn't working for them. So I started to listen, just like with an open mind. And it was like an internal shift, really. If I think back on it, it was an internal shift from, I'm going to tell you what to do, what's right, what's working, what will work. I will tell you what will work, to, wait a minute, let me listen and hear what's working for you, what's not working. And people intuitively know. It's amazing too, the kind of the understanding you can glean from people when you really listen, and then you start looking for patterns in what people are saying. And it just became abundantly clear that some people cannot come off these medications very easily. And coming off, I heard the words repeatedly when people described their experience of trying to come off something like Lexapro is torturous, horrendous, worst experience of my life, which was not reflective of what they went on it for in the first place. There was a mismatch. So it was like, wait, then what happened, or what is this? And there's and even the things they would describe that they would feel would not line up with things of like anxiety or panic or even depression, whatever they were experiencing of in terms of withdrawal symptoms would not be the same as what would meet criteria for those other conditions. So I started to listen, and in genuinely wanting to help people, started to help them do slow tapers. And there's a huge peer-based online support community around this topic. Nowadays, you don't have to go far to find people's voices coming out online through the advent of the internet, sharing their experiences online about trying to come off these meds. For example, there's like there's Facebook groups dedicated to this. Cymbalta Hurts Worse is like 37,000 members. And when you hear people's reports and stories, and then you hear patients describe it, you're like, this has to have substance to it. And there's so little that we actually truly understand and know about these medications, it seemed worthwhile to listen. And then it was figuring out how to do slow tapers. It's for every day is a learning process for me. I am on the job learning from people's experiences, from other resources that are coming out to try to understand how to help people safely navigate tapering. So there's my long answer to your short question.
No, I think thank you for sharing that. It's so important. And just as you were saying, just listening to your patients is so powerful. And that, excuse me, that in itself, I think is therapeutic, because I've seen patients similarly who said tapering off Lexapro was the worst experience of their life. And the symptoms of withdrawal felt worse than the reasons they went on the medication in the first place. But then there isn't, this sort of understanding in the medical community about what that is. And so then patients feel dismissed. They feel like it's all in their head. They feel like something's wrong with them, that they are doing something wrong, that they're a hopeless case, that nobody can help them because their doctors don't know what's going on. And so just simply listening to them and reflecting back to them that, look, there's all these communities of people who are dealing with this as well. And this is a phenomenon that we're seeing in our patient populations. Just that in itself, I think, is very reassuring for people to hear.
Oh my gosh. Yes. It's a very lonely road to be out there. It's like being in the middle of the ocean by yourself, to suddenly, because you're being told by your doctor, things should be fine. It's relapse. This is just relapse of your and when you're not heard by the person that you went to in a vulnerable state to get help with, when you're not heard or believed, that is I'm astounded at people's strength, honestly, when I hear some of the things that they've been told or go through. And I have to think about the times that earlier in my career, I might have said that. I probably did, because I didn't know. So I would have said, oh yeah, I guess you need the medication. Let's put you back on it. So people stay, it keeps people trapped in a loop of being on a psychotropic, psychoactive, mind-altering substance that they don't want to be on. And from an initial distress standpoint, don't need to be on, because whatever that thing, that time period, or whatever it was that contributed to them feeling that way has passed. They've grown, they've changed, they've learned better self-care, they've just aged. Maybe your capacity to help yourself with your own mental health when you were 24 is different when you're 32 or 44. And also, it's fascinating now too to see people who've been on these medications since they were 12. And now they're 20 something or 30 something or 40 something. It's an interesting thing that we've created societally without a whole lot of great direction to give these people. Because do we truly know what is the impact on the brain with long-term use of these? Do we know, can we say this is exactly what your brain would be going through and how this would have impacted your physiology and the development of your neurological system? We can't say with certainty. We can go by people's reports of how they feel, a report of symptoms of withdrawal, but we can't say exactly, we don't know. And so this it's such a big gray area of unknown, but there's still that traditional approach that still, oh, we know. No, we know. Like it just got announced just recently about the debunking of the serotonin hypothesis. And we were really sure about that. Oh, you have a chemical imbalance. It's your serotonin. It's not, or we don't know. That's essentially. And my adage or thing is like just approaching this with so much more of a mind of, I'm open. I'm willing to learn. I'm willing to listen to this person in distress, and I'm willing to try to figure it out along with them. It's a constant, we're figuring it out together scenario, rather than like I'm dictating like, oh, here's your treatment and here's how it works and this is what's good for you. And it's not like that anymore. And I don't know. Yeah, I don't know how long can we sustain that model versus an approach of we're figuring it out. Doctors are so pressured to know it all and have all the answers, and there's huge amounts of pressure to have all the answers and to be the authority. But this is a realm of medicine, and I think that's appropriate for certain aspects of medicine, I'm sure, but for mental health, not. So.
Yeah, no, exactly. It's not like surgery, where you can measure something and then you can remove it if it needs to be removed or whatnot. Whereas with mental health, there's so many factors, as you listed out, that contribute to it. And even just thinking about the microbiome and nutrition and all of those pieces, there's all these different puzzle pieces to look at. And unfortunately, generally when they go to see like a psychiatrist in their insurance network, and I'm not generalizing, there's amazing psychiatrists who take insurance, but generally it's medication management. Like they'll even call it a medication management clinic. And we're missing all of these other pieces. And so that's why I think it's so important that psychiatrists like yourself take this holistic approach. And for anyone listening, I just want to be clear that we're not saying that you should never take medications. Medications can be life-saving in many cases. But it's very important for people, if they're being prescribed, let's say they're being prescribed an SSRI for anxiety or depression, that you have a conversation with your doctor about the expiration date on that treatment. And I know in our practice, one thing we do is even if it's a supplement, we'll talk to our patients about how long they're expected to stay on that, whether it's a supplement or a medication or some other treatment. Because what can happen is once it's started, it's never stopped. And then, like you said, they might. So that leads us into the question of when is it time to start thinking about tapering meds? So if someone's listening and they've been on an SSRI or some other medication for years, or even less than that, when is it time to start thinking about going off of it?
That's such a great question. I'll try to think if I can generalize anything about it, but I think it's such an individualistic thing. And maybe here's some generalities of, okay, say you went on an SSRI because you had a loss in the family. You lost a parent or a grandparent or something, or you had some kind of personal loss and you ended up on something like an SSRI. So there was obviously, which is common, which, and just to know that happens in the medical system, that there will be situational issues and people will get medication for it. And so if that happens to be you, thinking about it of when did that circumstance occur? How are you feeling about it now? Are things stable now? How long have things been stable? And it's I think it's so much too a very personal decision about, people seem to intuitively have a sense of, I don't think I need or want this medication anymore. And a lot of times what drives that will be side effects, sex drive, or a huge one. I think a common one across classes is that feeling of numbness. And that numbness comes across as I don't have any passion for anything, almost to the, also too like a sense of blah. I'm not motivated to do stuff. And it's not that there's necessarily a depressed mood per se, or depression, other aspects of depression apparent. It's just, I just don't feel so engaged in my life. So that numbness, because that's in essence, that's what a lot of the medications are designed to do, if not all of them in some respect, is to numb. So you have an overwhelming emotion, right? Overwhelming anxiety or overwhelming feeling of sadness and depression. The medication, in its essence, numbs that feeling. But there's no magic place where it can go into your brain and only numb anxiety or only numb the certain feeling of depression. It's going to universally numb the human experience. And people, that's a big motivation for people to start questioning. I would love it if it was just part of natural medical protocol of asking somebody if you've gone on an SSRI like every 6 months, or at least every year. How do you feel about this medication? What kind of side effects are you having? Does it still feel relevant to you? Rather than what most of the time happens is it's continued, it's prescribed and prescribed, because it's just, that's the tendency, I think, in the system that we've also devised as the medical system, in a 15-minute appointment. And if you have other things to cover, especially if your general practitioner is prescribing it, do you have time to delve into that? And that's not a quick discussion. That's why I think, and one of the driving factors of being able to work outside of the insurance-based system, this takes time. These are not quick decisions. These are not things to flippantly decide. And you truly do have to be there and look at the whole situation for the patient. And then you have to be in touch with them. It's a different kind of relationship and communication, in that there's just more space to have a closer relationship and to help that person find their way to what's the appropriate treatment for them or situation for them when it comes to their mental health.
Yeah, it's such a great point, because you need that time and space to also explore the other factors that are going to help the person taper off the medication, because it's not a matter of just, like you were saying before, just, okay, let's cut the dose in half and half again, and we'll do that over a few weeks. There's like a whole body approach that is often needed to support patients with these tapers. So maybe we can go into that. And I know it's so personalized, right? Everyone's situation is going to be different, and the protocols, the approaches are going to be different, but maybe you could speak generally like how you might support a patient with tapering.
Yeah. I don't do tapers in a vacuum. It's not it, and I've actually started to hear about that, is there's tapering without, it's just the tapering, which maybe that's good and helpful in terms of the direction that's going, is some, at least providers acknowledging like tapering is a thing. You might need to taper your Celexa or Zoloft or whatever. I'm glad to hear that. But there's another key piece of that, which you just mentioned, and it's the holistic approach. It's, have you addressed the initial distress, first of all? Because the medication got started for a reason. So let's look into that. How did that get addressed? What happened? Where does that reside within you now? Like, how does that live for you now within yourself? How do you relate to that? What happened? Is there, so things like therapy? Has there been therapy? Have you been involved in groups? Have you done any kind of holistic practices? So things like any kind of relaxation practice, anything that helps your autonomic nervous system to come into better balance or more ease. And then absolutely talking about nutrition, dietarily and supplementally, what's going on there. Because if you think about it, and going through tapers is tough, because a person has already identified themselves as someone who needs to taper, who can't just stop it more quickly, and supporting your whole system through that. And nutrients are a huge piece of that, because what your body, the processes that it goes through, and the things that are the building blocks of those processes to make and regulate neurotransmitters, to regulate inflammation or different things that can affect our mental health. Your gut, I mean, your gut's a huge one, which now, fortunately, pretty much everybody knows that gut brain connection and stuff, but convincing people that you have to poop every day and that affects your mental health. Fortunately, nowadays, you don't have to do so much education on that, but absolutely addressing diet and nutrition. Like I mentioned, either both what you eat and our supplements for you. Some people are clear, supplements are not for me. And I appreciate that, because a lot of times when they're tapering, their system is sensitized and it's just, that's not something that works for them. Most people I see are probably using some kind of supplement. A lot of people come already on something. And then we talk about their options. And I'm big into just general nutrients, plus maybe some omega-3s. And if there's specific things that they want to address, like sleep or anxiety, and then exercise is another key piece of it. And essentially anything that is one of the factors that affects how you feel in general in terms of your overall health. So exercise is a thing, and the funny nuance with exercise is that a lot of people who are going through tapering and experiencing withdrawal can't tolerate intense exercise. I don't know if it's like the cortisol, I don't know the mechanism, but I've seen it repeatedly where people, they can do walking and stretching, which is fantastic and great, but if they try to go do some high intensity thing or go back to lifting weights, they're suddenly like, oh my gosh, I feel terrible. That piece of things, those are some of the big ones. And then of course, like what's going on in your life, relationships, your work, the things that can affect your overall mental health, addressing that. But that's key. So everybody that I see gets a plan. It's literally a document. And we walk through that plan, which includes a whole deep dive education and plan for the tapering, of course. And for that, there's a whole lot of nuancing around that as well. Everybody's their own blueprint for their taper. I can give I've learned over the years now, like generalities for how to approach them. But everybody's their own unique blueprint for their own taper. So we really try to find out what that is based on a person's comfort. And then the way that do we have to use a compounding pharmacy, or figuring out that also the formulation of the medication too, to help assist with that. But it's a whole thing. It's like for every person, it's not a drive-by thing. It's a whole thing. We get into it. And then having time for people to implement the changes, supporting those changes being implemented, and which is a good preparation to then to be able to taper, and then continuing that stuff as a person is tapering.
Yeah, absolutely. It is a whole thing, and it's so personalized. I've had patients who were able to taper off in a few months. I've had other patients where it took us like over 2 years to taper. And so there really is no one size fits all approach, as you were describing. And an important thing I'll just highlight that you just said, so for anyone who's listening, is that there's a preparation phase with tapering. So it's not just that, okay, we're going to start reducing your medication dose, and now you can start exercising or spending time in nature or working on relationships. Oftentimes we'll have this preparation where, okay, let's get some pieces in place first before we even start reducing the drug.
Exactly. Yeah. Nowadays, a lot of people come, fortunately, they're already trying, because they are so desperate to feel better. They're already like trying some things, but absolutely, preparation phase is absolutely important.
Yeah. And I think just being gentle with oneself and having self-compassion through that process. And it's okay if it takes longer than you wanted it to. That's just how it goes sometimes. And can you just really take care of yourself throughout that whole process? I think that's such a key component.
Yeah, I would agree with you. And I would say I think one thing people struggle with is being gentle with themselves. Understanding that if they had a broken leg, people would see them and say, oh, okay, yeah, it's okay, go slower, do less, get more rest. But when someone has something that's going on in their brain, in their neurology or the brain's biochemistry, nobody can see that. And so people have this expectation that they should be able to just keep on keeping on at their same pace. And some people, we try to design it in such a way, or the taper, my goal is with people, if that's what they want, is to put the taper to the background. Let's put this to the background. You live your life, rather than, oh my gosh, these withdrawal symptoms are the only thing I can think about because I feel so terrible. We switch it most commonly to, we put the taper in the background. It's so slow and low that people can go about their daily life and still engage in work to the same extent and taking care of the kids and doing all that stuff. But I do find it commonly that some people have a really hard time with kind of dialing things down or taking a rest or letting themselves off the hook or being gentler. Ultimately, it's interesting is that being gentle with oneself is a key piece that people struggle with. Which is,
Yeah, it's the opposite of the way that we're taught to do things, right? The opposite of hustle culture and burning the candle at both ends and all of that, all of these sort of cultural messages that we've received from a very young age. But let's talk about who should not taper. Like, how do you determine if a patient comes to you saying they want to taper up their medications? You do an assessment to see if that's even appropriate for them. So, are there people who should not taper meds, or what might factor into that assessment?
yeah, that's a great question. And I think it can do with potentially the severity of the original distress that they were experiencing and what diagnosis was that. What I've seen, and has there been a hospitalization? That's a big factor. When was that last hospitalization? What is that, the original instability? What is that? And what I find is, or what I've observed, is a huge portion of people can reduce their medication and make a reduction in it. Not everybody, I've seen people try to taper and then become unstable. I would say that's more common in diagnoses of schizophrenia, bipolar disorder. Those, of course, handling that much, much more gingerly. I've also seen someone who has been off, who was hospitalized multiple times, had ECT, was in full-on treatment for bipolar disorder, and she's been 13 years, I think, is it 13 years med-free. So as a practitioner and provider, it's my whole goal for people is stability. If we're rocking that boat, let's not do that. People need to function. And for some people, medication is a piece of that. And I don't have a way of determining, like, okay, this is going to be the way that it is for you, and it's very complex or complicated. And that's why any reductions go really slow. And if a person can't engage in the self-care stuff, that's a huge determinant, which in itself just gives a lot of information. If a person can't do all the things, the exercise, the nutrition, and all of that, then tapering tapering off may not be possible. And it's hard to say. You figure that out having a lot of conversations with that person and being very gentle. Don't do anything big or rash in terms of any kind of reduction or anything like that.
Yeah, I think that makes a lot of sense. And as you were saying, the stability piece is key because that's often why the meds were started in the first place, to give the person a sense of stability.
Yeah.
And so we want to maintain that sense of stability as they go off the medication. And one of my kind of philosophies around treatment, if we want to call it that, around just supporting people with these things, whether it's anxiety and depression or sleep issues, is really to help them find a stable foundation so they can explore their full potential in life. Because there's all these other aspects of life to explore. There's all these different dimensions to explore, and we need a stable foundation to do that. And so if people are like all over. Their symptoms are up and down, and they feel like they just can't get a handle on things. It's not really serving them.
Yeah, I couldn't agree more with, yeah, stable foundation. If you don't have that, it's, yeah, like you said, I love what you said actually then about being able to experience all the different aspects of what being human has to offer. The essential piece is certainly stability. Yeah.
What about if someone has recurring symptoms? So this is another question that comes up a lot, I think, from patients is, okay, let's say I taper off the medication and symptoms come back. Does that mean I need to go back on medication? Should I go back on medication? How do I know if this is a recurrence of symptoms or if they're withdrawal symptoms? How might you navigate that conversation with somebody?
Yeah, it's definitely delving into how fast, what was the history of all of this? How fast did they come off? Because I would say tapers can often take, if somebody's been on a medication for years, tapers take years, which can be distressing for people, getting their mind around that because they want to be off this thing yesterday, and helping them understand and get in, just wrapping their mind around this probably won't be months. This might be years, depending on how long you were on it, what is it, what dose, all those kinds of things, how much self-care is in place and all that stuff. But I think this particular piece is that discussion about, okay, what are you experiencing? A lot of people very clearly can identify withdrawal versus their original distress. Their original distress, they remember. Oh, I felt like this before. It feels like that. Withdrawal, and withdrawal can have a constellation of other things happening in other areas of their body, like particularly GI. Or there's a lot of like numbness, tingling, feeling off balance, or things like that. So it's going to be an individual conversation with everybody about, what does this feel like to you? How fast did you taper, first of all? Because if they tapered something that they'd been on for 15 years and tapered it over 4 months, again, depending on the dose, high likelihood of withdrawal in there. And then also too, looking at what was done, what do they feel was done to address the original distress? Do they feel like whatever kind of therapeutic measures, whatever that is, therapy, self-help, all the self-care stuff, did they feel like that they took care of that aspect of themselves?
Yeah, yeah, that makes sense. Yeah.
Yeah.
I think what this highlights is that it really is a personalized approach, and that's why it's important to talk to a professional who understands the nuances around this. As as we wrap up, is there anything else you would like to share with people who are watching? And then we can talk more about how people can find you. But any last ideas or thoughts you want to share?
Maybe something that I would have wanted to tell myself, yeah, 25 years ago when I was trying to figure out anxiety is, yeah, knowing your options is possible. The knowing all of your options can be really empowering, and then you can decide. You decide what's right for you, what resonates with you. It's good to find a provider or a person that resonates with you, or that you feel is hearing you. You deserve that. Everybody deserves that. That you're the person that's going to help you navigate your mental health story and journey. You deserve to have the feeling that they resonate with you and that they are hearing you and listening to you. That's probably my one thing I'd say.
Yeah, absolutely. Yeah, that's fantastic. If people want to work with you, where can they find out more about you? And I know your practice is online, so in which states are you able to work with people?
Yeah, so you can find us at True You Psychiatry and Wellness. So our website is trueyoupsych.com. I'm licensed in Arizona, California, Georgia, Florida, Virginia, New York, Michigan. All right, I remembered them all. Yeah. And it's all virtual. So they're virtual.
Great.
very easy to schedule right through our website, or feel free to give us a call if you want to ask more questions, if you want to get more information. We'd love to hear from you, from those who want more details.
Amazing. Thank you so much, Dr. Giordano. Always a pleasure to talk to you. I always learn new. I will put the link to your website in the video description so people can click over there and check out your practice. But yes, thank you. I really appreciate you sharing your time and energy and expertise.
Thank you. Thank you so much. It was a pleasure and delight.